Good afternoon, everybody, and welcome. As Leslie said, this is the Dental CT Accreditation webinar, demonstrating quality patient care in your dental practice. We're very excited to be here. My name is Mary Lally. I'm the Director of Accreditation for this program, and we have several other people joining us today. We're honored to have Sandra Katanik, the CEO of the IAC, and she'll be presenting some of the webinar with us today. But before we get started into the presentation, just a few minor housekeeping items. As you all know, there's a question and answer session at the end, and if you look in the upper right-hand corner, there's a little Q&A tab. We suggest that you jot down your questions throughout the session, and at the end, Linda will call on you, or Linda will ask the questions to me and Sandra, and we'll answer those for you. Also, if you have any issues throughout the presentation, you certainly can jot your question in there. Or if you need help at any time, you can contact us at webinars@intersocietal.org. We have Linda and Lawrence helping us out today as well. So with that said, we'll go ahead and get started. Today, what we want to do is just give you a brief overview of the IAC program, give you some key pointers on the website and the navigation of the website. We'll look at the components of the standards that are most pertinent to you, the required documentation, the online application, the submission requirements required with the application submission, the accreditation decisions, some helpful resources, and then we'll open up to the question and answer session. Now, what I'd like to do is turn the presentation over to Sandy Katanik. Again, she is the CEO, and she's going to give us an overview of the IAC program. Sandy?
Thank you, Mary. I think I went too far. I did. Thank you all who are in attendance on this call. We are really excited to expand our program to the dental community for CT accreditation. So I wanted to start out the program by talking about who is the IAC. The IAC is the Intersocietal Accreditation Commission. We have 20 years of imaging accreditation experience in very many different modalities, and I'll talk about those in a minute. And our board of directors for each one of those divisions are actually specialists in the various medical fields associated with that type of imaging or those therapeutic procedures. And currently today, we enjoy over 10,000 accredited IAC sites. So our program has been very successful, and we'll talk about some of the reasons for that success in a couple of minutes. This schematic actually shows you a bit of how the IAC operates. The organization itself is the Intersocietal Accreditation Commission, and it has 6 divisions. Vascular testing is a diagnostic division, and that was our first division. We started with that in 1990. We added echocardiography accreditation in 1996. We added nuclear and PET accreditation in 97, MRI in 2000, and regular diagnostic CT we started in 2007. We just this past year offered or wrote a program for dental CT, and this is specifically for volume cone beam scanning. And we'll have a couple of poll questions throughout so that we can have a better sense of our audience. We also, and that dental CT program is under the ICA CTL program. We also have one therapeutic program right now, and that's for carotid stenting. And this year we added another program for venous clinic accreditation. So we do all sorts of accreditation programs, primarily in diagnostic imaging. We also enjoy the sponsorship of about 34 organizations. And our latest sponsors, as you can see just about halfway down the first column, is the American Association of Oral and Maxillofacial Surgeons. We actually had several dentists involved with helping us developed the standards for CT dental accreditation for the volume cone beam scanner. All of the other organizations here represent the various societies in the various other imaging modalities that we offer accreditation for. So what exactly is accreditation? Obviously, it is a seal of approval, if you will, that you have met standards of quality. It's a validation by your peers of the quality of the care that you're providing to your patients. It also provides a recognition for the quality of your services, and Mary's going to show you some good examples of what types of recognition you receive for this. And most importantly, and we hope that most people use it for this, it should be a tool for a continuous process improvement in your practice as it relates to scanning, to CT scanning. We definitely, there are definitely some other values to the accreditation. Mostly, it's a demonstration to your patients that your practice has qualified professional staff, that they have emergency care policies in place, that they have radiation safety protocols in place. And this is really critical in today's healthcare market because, as all of you I'm sure are aware, radiation safety is a huge issue in imaging today. And what we are finding is that patients are becoming more and more aware of the importance of radiation safety. So that's a big component to our program that Mary's going to go over. Also, what you will demonstrate is equipment quality control. You'll definitely demonstrate the fact that you have produced high-quality diagnostic images for your patients with comprehensive interpretations. So I'm going to talk just a minute about some payment policies because I think this is probably a pretty critical reason why many of you are on the call today. You may or may not have been aware that in 2008, Congress passed a law that is typically referred to as MIPA, meaning Medicare Improvements for Patients and Providers Act. And what that law required was that any suppliers furnishing the technical component of advanced diagnostic imaging services billing under the physician fee schedule, meaning Part B Medicare, would be required to be accredited by January 1st, 2012. And note that I said required. This is already in the past. So if you are doing CT procedures on any Medicare patients, and you're not accredited, you will not get paid for those procedures until you do become accredited. Medicare defines advanced diagnostic imaging services as nuclear medicine, MR, CT, and PET. And one of the interesting things is that for some reason, nobody really clearly understood that the dentists were actually part of this, that this bill affected the dental community, those that utilize CT scanners in their practices. And we know from our interactions with many of the dental specialty groups that we are seeing more and more CT scanners being installed in dental practices. So if indeed you are billing any of those CT scans to Medicare under Part B, you are required to be accredited. Also, we know that there are various private insurers that may require accreditation. Certainly in the medical imaging, absolutely, there are lots of private insurers that require accreditation as a condition for payment. We are a little less familiar with the private dental insurance companies, and would certainly encourage anybody that hears of a policy or sees of a policy to contact us so that we can update our website. Well, and so with that, I'm going to turn it over to Mary.
Thank you so much, Sandy. Before we move on and we talk about how you get started with the accreditation process, and just, if you will, I'd like to take a poll. And actually, we're going to take two polls, if you don't mind. The first one is, You can see, do you currently own a cone beam CT scanner? And your selections are yes, no, but you plan to purchase one in the next 12 to 18 months, or other. You're just here because you had some free time and, you know, just wanted to listen to the dental program. Okay, great. Just give a few more minutes. Okay, great. So the majority of you do have a poll. I appreciate you taking the time to do that. That helps us. And then we're going to go ahead and take one more poll, please. And it is, Medicare patients make up what percentage of your practice? And less than 50% or greater than 50%? Okay. Very good. Some people are not sure. Okay. Very good. Again, thank you very much. We appreciate this feedback because that helps us direct the rest of our presentation, and also shows your commitment to quality patient care, and that you're on this webinar and you're looking to seek accreditation, hopefully, in order to improve your processes. So, okay, so how do you get started? Well, what you need to do is go to our website and access the dental standards. As Sandy said, we have sponsoring organizations for each of our divisions, and dental falls under currently our CT program. We have 20 representatives from various imaging and medical societies representing with CT expertise. So the board of directors have written the standards. They also edit the standards and review those on a yearly annual basis and review and edit as necessary. And then they also render the final decisions on the applicant facilities. So the dental CT standards, they outline the staffing, the training experience guidelines. They outline the patient safety and confidentiality policies. They require your equipment QC and physicist oversight, radiation safety adherence, the report content, and your overall quality assurance program. So when we get to the part in the standards, I'll show you some pertinent areas. So when you first access the website, you're going to be on the main CT site. However, if you look in the upper left-hand corner, you can see there's a little dental CT program tab. You can also access from this the standards with the drop-down menu that is along the top of the screen under CT, ICA, CTL. And you see we really are very excited, again, to offer this accreditation program to our dental community. And we have some good information on our website that we'll get into a little bit later in the presentation. So when you first click on the Dental CT tab, you can see that there's an introductory page. We give a little outline of how important dentists are to the community and how imaging obviously is an important component of that as well for treatment planning. We have some links there to the IAC program, the policy and procedures, and also to our CT dental board. Moving further down that page, and this is the same page, you can see that we have key elements of getting started. And this is a very important page for you all to be on. So when you first go there, that's why it's front and center. This has all the information that you need to get started with the program. You can create the online access. It gives you a required documentation checklist, the case study requirements, the fee requirements, as well as the IAC accreditation agreement. And as I go through the program, we'll look at these in more detail, and I'll actually show you the checklist and so on. But the first thing we want to do, again, is look at the standards. The standards are the basis for compliance. So I strongly encourage you to download the standards, highlight any areas where you feel you may have some deficiencies or shortcomings, or you have questions. When you download the standards, they're broken up into organization and testing. And there are various sections that you can actually click on. It's a very neat tool. The menu actually can click on while you're in the standards and go right to that appropriate page. So it's a very nice tool and very easy to use when you get on the website. Now, I'm not going to go through all the items. Actually, I'm going to go back to that. You can see that it's broken down in the personnel and supervision. So this outlines your training experience requirements for your dental or medical director, your dental or medical staff, your technical staff, the physicists, as well as the support services. It outlines the physical facilities of your practice and what should be in place. Also gives you the information for your examination records and retention, dental practice safety and patient confidentiality policies, and if you do have more than one site, also the multi-site policy. Part 2 deals more directly to the instrumentation and testing, gives you the quality assurance for your equipment, how to order and the appropriate clinical indication in order to do the CT examination. Obviously, you need a patient identification policy. The components of CT exam performance, a very big one, the exam interpretation and final report, recommended procedure volumes, and then your overall technical interpretive quality assurance program. So all these are outlined in the standards, and again, it's suggested that you download these and adhere to them and put processes in place if you find you have some shortcomings. Now, I'm not going to go over every line item in the standards because for the most part it's straightforward, but I will look at the training experience requirements for the dental and technical staff. So there are several pathways in the standards for your dental or medical director, and the first one is the formal training. So that staff member has to have a completion of residency in a dental specialty that includes advanced radiology imaging training as part of the curriculum and approved by the ADA or the Commission or the Canadian equivalent, or they can be board certified by ADA recognized dental specialty certifying board that includes advanced radiology and imaging training and recognized by CODA or CDAC, or board certified or board eligible within 2 years of finished training in a medical specialty recognized by the American Board of Medical Specialties, Osteopathic Association, or the Canadian equivalent. And they need to have a minimum of 4 months formal training in CT and at least 1 year full-time CT experience with independent interpretation of at least 150 maxillofacial CT studies. So again, that is formal training. Now, the thing you want to do is when you understand your staff, you need to look at them, make sure they meet one of these training experience pathway. And if you have questions, if you're not sure, that's where you call us and we'll help guide you through that process. Now, another pathway that they can meet is through informal training. And this is where they have documented interpretation of at least 150 mentored maxillofacial CT examinations, have attended at least 20 hours of CT training with a letter of verification from a program director, and have at least 20 hours of CT training that includes radiation safety as well as a test by a medical physicist or qualified expert. You can see the trend here where we are very clear that radiation safety must be a part of all these, and from our contacts with the dental community, we feel that this is not too onerous for them to achieve, and many of the programs already have these incorporated into them. And the last one is training experience requirements as established practice. And this is a dentist or a specialty dentist or physician who has been interpreting CT studies for at least 3 years, has acquired 50 hours of ADA, CERP, or AGD PACE continuing dental education and or Category 1 medical indication. And these 15 hours must be in CT training and 3 hours of radiation safety and pass the test by a physicist or qualified expert. And they also must have interpreted a minimum of 150 documented maxillofacial CT exams with self-attestation. Now, some of you, depending on how you operate, your dentist or your oral surgeon or your dental physician may do the interpretations themselves. So if that's the case, as long as they meet one of these criteria, that's fine. They can do the interpretations and complete the final reports. Some practices have a radiologist read their examinations. Again, your radiologist would have to meet one of these training experience requirements and demonstrate to us that they meet these training experience as listed in the standards. Some of you may have a combination. You may have physicians that do their own readings, but you have radiologists that do overreads, and that's fine. I mean, that is the real world, and that is fine as well. You just have to list anyone that's listed on your final report in your case study submission must be listed in the application and meet one of these training experience guidelines. So now moving on, for all the pathways that I just mentioned, all operators other than those that are your radiology interpreting physicians must have 4 hours of documented training on the equipment as well as a minimum of 3 hours of radiation safety training. And that's pretty much already detailed in the actual pathways, but we just want to reiterate that again. So now moving on, obviously you need to have at least one dental or medical director listed in your application as well as one dental technical staff member. And this person can be a state licensed dentist or board certified in a dental specialty by the ADA or a licensed physician in a medical specialty recognized by the ABMS or the Canadian equivalent. Or there can be a licensed dental hygienist with radiation safety training as part of the curriculum. So this is pretty much the person that's going to run the CT machine. You can have your dentist run if that's the case, depending on how your practice runs. So again, the operator of this system must meet one of these training experience requirements. Also, another pathway is a dental assistant that's state licensed or authorized by the State Radiation Control Protection Department and is in compliance with the State Dental Board regulations. Or you can have an RT or the Canadian equivalent run the scanner. So again, these are all outlined, and any other dental staff or technical staff that you have, there are also training experience requirements outlined in the standards. Again, anyone listed in the application has to meet one of those pathways. The same for the technical staff. Again, they have to have documented training on the equipment as well as radiation safety that is documented. Most manufacturers actually have that documentation, and have a physicist that can also generate and give you that test. So if you can't find that, please let me know or talk to your manufacturer, and generally they provide that training for you. All dental and medical staff are required to have 15 hours of ADA or CERP or AGD PACE, continuing dental or Category 1 medical education credits, and this has to be acquired over a period of 3 years. The same for the dental staff. 3 hours have to be documented in radiation safety, and you are to keep your CE on file in case you're audited or during the site visit of your practice. We are, because this is a new accreditation program, and the board understands that. We know this may be difficult, generally is a difficult issue in our other programs is obtaining CE. And due to the fact that you do have Medicare patients, and right now currently we're not getting reimbursed for those patients, at the time you apply, you do not have to have the 15 hours when you first apply. If you have it, that's great, and you're going to document it, but you will be required to document that when you reapply for accreditation in the 3-year cycle. Okay, so that's a good thing. You can go ahead and apply. If you don't have the 15 hours right now, you should be obtaining it along the way, but you can apply right now without that. You do need to fully meet, though, the training experience requirements as detailed in the standards and as I just discussed. Now, again, you saw the standards. It's a pretty lengthy document, and it's pretty straightforward, so please take a look at it. The one area that I do want to emphasize is the report content, because this is an area that generally presents some problems in our other divisions, and mainly in our CT division, we have an ENT specialists that use the volume cone beam scanner, and one thing we noticed that they didn't have formalized reports. So this was an area that really presented issues with them, and some of them had some real problems. So I just want to point out the items that are required to to be in your reports. So, and these again are in the standards. You need to have the patient name or ID and the patient age or date of birth, the date of the examination, the clinical indication, an adequate description of the test performed, including the name of the exam, the protocol used, and the quality of the study, a summary of the pertinent test findings or treatment plan parameters, comparison to previous studies if they are available. The reports must be typewritten. We know that, at least, again, and we're learning about the dental community ourselves, so, but what we learned from the ENTs, a lot of them had check-off lists as part of their patient record and not truly a dedicated CT report. And some of them were handwritten. So this is real important that they are typewritten, that you have the date of signature or verification from the interpreting physician, and that there is the physician's or the dentist's name is printed, and then there's a signature that's entered either electronically or manually, and that, again, it is dated. So we do have some examples, and I'm just going to put one up here. This is a sample report that includes all the items that are required of the standards. So you can see the date, the patient name, the diagnosis or the clinical indication. You're using the volume cone beam scanner, and again, you have another diagnosis here. He included that there are no previous studies. The technique is very nice. This is actually very elaborate. The board just wants to see that you at least indicate that you're doing a volume cone beam scan, a CT scan on your patient. But this is really a lot of detail. The second half of the report, again, a clinical history, the image quality, and then, of course, your findings and impression. It has to be digitally signed or manually signed with the date of the interpreting dentist or physician. So this is really a good example, and this is something that we'll provide for you as a template if you want to use this. So with that said, we're going to go ahead and take another poll if you don't mind. And this one has to deal, as you might guess, with reports. Do you currently have formalized CT reports in your practice? You just take a moment to help me out and answer that question, please. Okay, great. Good. Looks like this might be an area that you may want to really spend some time in formalizing. And again, we're here to help you with the report content. Okay, thank you. I'm going to go ahead and close that poll. Really is helpful, these polls. At first I didn't like them, and then as I started using them, I find that they are valuable information to help guide me and actually guide our programs. So when we call you, or when you call us actually, we can give you some feedback. The next thing that's really important is document preparation. As I said, when you go onto the website, you're going to go onto the Dental CT Program tab. On that page, the key elements for getting started, all the items you need are there. So one thing that you're going to need to do, as you know, is have policy and procedures. From the key elements of getting started page, that main page, you can see there's required documentation and there's a link. And there's a checklist. This checklist has everything that you need to submit. It has your staff documentation, policy and procedures that are necessary, your quality assurance, the case study, and the accreditation agreement. I don't know about you, but I really like checklists. When I'm preparing something of, that there are various segments and various people involved, I like to know that, this step is completed, this policy is done. So you can use this. You don't have to use it, but it is a good checklist, and these are the requirements of the standard. So they will be asked to be uploaded in the application itself. And when we get to the application, you'll see that part of it. However, my recommendation before you even start the application is to prepare your policy and procedures. Make sure you know what training experience pathways your staff are going to qualify under and get any supporting documentation that is requested. We will ask for your license, and if you have CME, that will have to be documented as well. We'll ask for your quality assurance, and of course, gather your case studies and the final reports that are associated with those. So again, this checklist is there. You can download it, and in fact, at the end of the program, we have that uploaded for you that you can have access to. So these are the policy and procedures. You're going to have to turn in your patient employee safety policy, which includes an acute medical emergency policy, radiation safety for your patients and staff, your personnel exposure monitoring records, and any incidents or adverse events policy that you have. Most of you have these processes or policies in place already. What we find in some of our other divisions is that they're not written down. So you may have to just tweak some of your policies that meet the standards or actually update them if you haven't looked at them in a while. Of course, patient confidentiality policy, the identification, your pregnancy screening policy, your patient complaint policy, and primary source verification, as well as preliminary and final interpretation discrepancies if you actually generate preliminary reports. Now, we also offer some guidance, and I'll show you that a little later in the program where the resource section is. Definitely for primary source verification and a couple others, we have some documents that you can download for reference and how to generate your policies. The next thing, a very important component, is your quality control documentation. When your machine is installed, there are acceptance tests that are done either by a physicist or by your manufacturer. If you have those, we want you to upload those into the application. We want your daily or days when the scanner is in use. We'll ask for 5 days worth of documentation, including phantom images, uploaded on a CD and sent to us. The phantom images need to correspond with the QC and results that you're submitting to us. If you have difficulty obtaining those phantom images or actually storing those phantom images, please talk to your manufacturer. They should know how to obtain those. Even JPEG and screenshots are okay. You will be required to have an annual physicist survey, and of course that's performed by a medical physicist or a qualified expert to include image quality and dose assessment. And again, if that's has not been completed prior to your submission, you can that's okay. You'll have to have that within the 3-year cycle, but right at the time of application, you do not need that up front. Hopefully you all have that. My understanding in speaking to some of you that have called is that this is just routine for you all to have your physicist in there. So that's really, really a good thing and very good for your patients. We'll also want to see your most recent preventative maintenance report, your radiation shielding verification survey. That should have been done at the time of installation, or if your system was actually moved, you need to have your physicist verify that the shielding that was put in or inherent to your system is adequate for your patients and for your staff. We'll ask for your CT protocols for both pediatrics as well as adults if pediatric patients' examinations are performed. And we'll also ask you for a technical quality assurance policy, which includes image quality assessment and review as well as dose assessment review, and we'll help you with that. There's more information in the standards about what needs to be in those policies. And again, an interpretive quality assurance policy where that's looking at either correlation or a peer review process of the comprehension of your interpretations. So again, the checklist is really useful, I think, because I couldn't remember all these, and I'd have papers all over the place trying to figure out if I had everything in order. So I think the checklists are a good tool to use. And of course, one of the important aspects of accreditation are the case studies and the final reports. I mean, this is why we're here, to get good images to help the patient and treat their issues. So these are the case studies that are available to you. You have the selection. You need to turn in 6, and they have to be submitted on a CD or DVD with a DICOM viewer installed. Actually, you'll turn in 2 copies of CDs. but a 6 total. If you have issues, again, not sure if it's DICOM, again, talk to your manufacturer. They're well aware. Most of them are aware of our program as well. So you have the option of choosing any of these. And when we get into the application, you'll see where you have to enter them. We'll ask you to also upload the report for each of these case studies. And I'll give you some helpful tips as far as uploading them as well. One thing that we do require, again, on your key elements of getting started page, that home page, we ask for a scan parameter form to be submitted with each case study. The link is here on the getting started page for you to complete, and it has to accompany each of your case studies. This is for the reviewer when they look at your study. Sometimes all the information or the parameters used, for whatever reason, the software does not allow it to come over on your archived images. So the reviewer just likes to see what protocol was used. So again, we'll ask that this will also, my suggestion is that you go to the Getting Started page when you're preparing your case studies, download this and fill it out because you will, and save it on your hard drive, because you will be asked to upload this in the application. So it's not paper. You're not going to turn this in via paper or green. We pretty much ask for everything electronically in the application. So please, just don't fill it out by hand. Well, you can fill it out by hand and scan it in, however works best for you, but it will have to be electronic. So next we're going to go to the online application, and I think what I'm going to do is share my desktop with you because this is a really important part of the process. When you're ready, and after you access the website and have your checklist and you're ready to access the application, it is free. You can access it from any web page. There's no time frame to submit the application after you have accessed it, so you don't have to worry about fitting into a 40-day window. But, however, realize that once you do submit your application and all supporting documentation, the review process does take 12 to 16 weeks. I don't know why that's in there. Okay. Again, you can access it from that home page if you want. You will be asked to create a new account. I'm going to show you that in just a minute from that page, and it looks like this. So, obviously, we need some demographic information. You will fill this information in. You'll put your contact email in there, and then the user ID and password will be sent to you. Then that's how you create an account. It's very simple, it's very easy, and it's quick. However, you need to remember that information once you get it and it's changed. So what I'm going to do, I think I'm going to go ahead and share my desktop with you, and you can actually see what this looks like. So this is the login page. So once you get your user ID and password, you'll obviously change it, and then you will secure it so that you can log in each time. So I'm going to go ahead and you'll see a little bit of the pause here.
Mary, this is Linda.
Mm-hmm.
While you're switching them over to the sharing of your desktop, I just wanted to remind them that they can ask questions using the Q&A panel. They click on the Q&A up in the upper left-hand side or corner of their screen, and they can enter a question, which will be asking you the questions, you and Sandy, the questions later in the presentation. I just wanted to let you know, because there's been a couple questions that come in. I just wanted those folks to know that we saw their questions, and we're going to pose them at the end of the presentation.
All right, great. I tell you, I don't know what to do without my help here, because I just ramble on, and I can talk about accreditation and the standards in the website all day long. So thank you, Linda, for reeling me in. I do sometimes go off on a little tangent here, so thank you very much. So anyway, I'm hoping you're all seeing now when you access your account, when you've created your account, you will be asked to log in, and you'll come to this page. This is your demographic page. This is called the profile. And you can see, as I scroll down, this is the information that you already entered for us, and you're going in to now access the information. One thing I want to caution you on, I shouldn't say caution you, should alert you to, real important to save your work. You can see there's a Save My Work at the top here under Organization Information, and then if you scroll down at the very bottom, there's a Save My Work too. It's a lot. It's a big scroll, actually, because we have everything on this page as well for you. So you've already identified that you're a dental CT facility, and you've entered everything that we need. Again, you're saving your work as you work through this. Now, when you first access this, you can see at the top, there are menus all at the top. You have Main, Applications, Manage Users, Manage Staff, Manage Sites, Manage Equipment, Reimbursement Data Sharing, and Contact and Log App. All that is still part of your profile section other than, of course, the application link. So the thing I would suggest to you, if you've been identified as a user, meaning you created an account, I suggest you go in and put someone else in there that can access your account as well. This way, in case you lose the information, you're off for a while and you really wanted to submit that application before you left on your cruise to the Bahamas or wherever, it is a good idea just to have someone else listed in here just for that reason. You can see on this page that we only have one person listed, so we went against our own rules here on this. This is a mock site, but you have the option to add a new user. So that's just something that we suggest that you do. Of course, you want to go to the Manage Staff link, and you're going to enter all your staff members here. Those that are listed on your final reports must be listed in the application, and any operators that are running the scanner must be listed in the application. So you can see here we have several staff members listed. It's very easy once you enter them to edit any information. So I'm going to go into Dr. Lally here, and you can see the status. Dr. Lally is still active. They're working in a dental practice, but their specialty is cardiology here. But anyway, I'm going to go ahead and edit that information. So when you first enter your staff, you'll be on this page. And you can see he's an active member. I'm designating Dr. Lally as my medical director, and so on. You have to answer everything with a red asterisk in order to move forward into the application. Remember, we're still in the profile, and Dr. Lally's a general dentist here. I don't know why he was a cardiologist in this application. So anyway, you can see it's very easy. We have a drop down here. If you don't see your specialty, please indicate it here in the other specialty for us. And if you're a doctor, let us know that. Scrolling down further in the mid-page is really important here because this particular doctor also, he works in CT/MR and carotid stenting. However, we want to access the dental application, so it's very important that we indicate that Dr. Lally is the dental CT medical director, so that we have to have two checks. And then to the right a little further, this is the medical director or technical director for this accreditation program. Again, if you don't fix that or indicate that with a check, you won't be able to move forward in the application. So if you're stuck not accessing your application, it means you more than likely haven't answered some of these questions that I'm pointing out for you. This is also the place where you would enter the CE. Scrolling down further on all your staff or technical staff, you can see continuing education. You would merely just enter the course name. And, of course, for dental, you would need 15 hours. And, again, if you don't have that at this time when you're first applying, don't worry yourself. Just move forward with the application. And then you just want to save your work. The same with manage equipment. So you're just moving along in the application or in the profile section right now. Again, of course, this one has already been entered for you, but you can see if you made a mistake, it's not a problem. You go back, edit any information that you have. The profile section is always available to you even after you submit the application. So again, by cone beam, this is what this program is for. You would enter that information and so on. The very important tab, as you can see, is the reimbursement or data sharing tab. We share data with CMS on a weekly basis. So if you do have Medicare patients and you do want to get paid for those patients, you need to enter your Medicare enrollment number and your NPI number for both the group and individual if you have those. It's real important that you do that. This is what's transferred to, again, to CMS. Once you're granted accreditation, that information goes to them on a monthly basis. On a weekly basis. Sorry about that. There's also some data sharing options up here. It's defaulted as you're saying yes that you would share this information with of course, Medicare and any private insurance. But if you wish to not subscribe to these, you need to uncheck this. Most people just leave it alone because they do want to share their information with the payers. But again, it's up to you. That option is there available. And if you add on a doctor or a new person to your practice, of course, there's an add new reimbursement information at the bottom, as you can see. Okay, so with that, now that you've entered all your information in the profile, we're going to go ahead and move to the application. And this is really a cool feature that we've changed. You all have the benefit. We've just undergone a huge branding initiative, definitely effective in February, but it's taken over a year to put everything in place. And this is one of the really key elements, and I think really helpful guidance initiatives that we put together for our applicant facilities. When you're in the application, and again, there's several here, we of course want the dental CT one, you can see where you are in what the status is of your application. For the dental CT, this one was started in January 26, 2012, and you can see the application status is in process. So that just means that they started the application. It's not been submitted. Of course, it's not in the review process. So it's really nice if you hit the submit button, you can see that you're, where you're at. Also, to move through, you have these little available icons here. The little move forward, you see this generally on, video player or something. That means you want to go to this application to continue the work. We have a little star. This is for your marking materials, and I'm going to show you some really nice marking materials that are available in the portal itself once you're granted accreditation. There's some tools for online application tools. We have a little online application calculator that you can, that I'm loading actually for you. If you don't know what the fees are or you can't remember, you can submit an estimate here. It's right here for you when you go into your dental CT profile. So again, we have one volume cone beam, we have one site. We don't want any additional certificates. We want no plaques right now, and then we'll submit our estimate. And that is exactly, I'm glad it worked, because that is the fee for one dental unit without any additional things. So it's all there for you, and it's really nice. And then when you reapply in 3 years, you also have access to your first application. So I'm going to go ahead and just move forward because I'm not done this application yet. And this is what you see when you first come access your application. The menu on the left is what we call the navigation tree or the tree, and the questions or the questionnaire on the right is the actual application or the questions. So again, the reason I say that and make a point of saying is because we can remote into your application and profile and look at the information. We cannot change anything or edit anything, but if you're stuck, you're not sure, you can't move forward, we can actually remote in and see it. It really, truly is a valuable tool. We've gotten on conference calls with people and walked them through every question, and that's okay. This is all we do is accreditation. This is why we're here. So if you are stuck, we have the tools. We can remote in, and you can say, Mary, I'm stuck on the support services in the navigation tree. And then I can go in, look at support services and say, oh, okay, I see where you're at now. So it really is a valuable tool that we have to help you. The other thing you can see here on the right, way to the right, I hope you can see it on your screen, is a support panel. we have live chat that we're here to help you, or email contact right away. So once you're in the application, you don't have to get out. Hitting the back browser is usually not a good thing in any application you're in generally, because it usually times you out. But you can just go to the support panel and click here for live help, or click for the FAQ panel, or live chat. So it's really nice feature that we've instituted for you. I think it is too. Okay, so getting back to the task at hand. You can see, and I probably did not mention this, but the application, the questions in the application are exactly the questions that are, or the statements that are in the standards, other than the case studies. So in this particular one, I'm going to look at the dental or medical director, and we talked about the requirements for them. So what you're going to do here, after you've reviewed the standards, you're going to tell us, Dr. Lally meets the established practice standards. So you just work through that, you know what that is, and you move forward. If you're confused, if you forget, we also provide, if you hover over this, it'll bring up that standard. It's really a nice feature. So if you forgot what the established practice is in the standards, you don't have to pull the standards up again. Just hover over it, take a look. Yeah, Dr. Lally meets established practice, and boom, you can move on down to the next question. It's really, we tried to make this more simple. We know this is not your full-time job, it's filling out the application. If at any time you say no, you would go ahead and just provide an explanation for us. And you would do that for all your staff, your physicist, and any technical staff that you have. Now, I'm not going to go again. This is pretty self-explanatory. You can see right now that they're all green checks here. That's important, because if you don't have a green check, you can't. So I'm going to go ahead and actually uncheck this. Let me go ahead. I can't. I've already done it. Anyway, if you don't have all green checks, you'll have a hazard sign. That means it's not complete and you can't submit the application yet. So you want to go through the whole process and get your green checks to answer every question. The one thing I did not say, which I should have, there are instructions here. Believe it or not, there are instructions. As I said, you will be required to upload all your policy and procedures and your scan parameter form and your reports. There are instructions. If you have any issues with uploads, this is where you find that information. You can't, it has to be in a proper format and can't be over 4 megabytes. But again, if you're like me, I just try to do everything without reading the instructions first. But if you run into a problem, the instructions are there. You still run into a problem, always give us a call. The introduction, yeah.
Hi, it's Linda again. Just wanted you to know that it is 1:55, and we wanted to go over a few of the questions that have been coming through.
Okay. I'm almost finished this part.
Okay. Thanks.
Yep. Just one more functionality thing I want to point out to you. Again, this previous next in at the bottom of each page is how you save your work. Real important. I should have said that right from the beginning. So hit previous if it's available, next or end to save your work. Once you have all green checks, you're able to hit the conclusion button. It brings up a screen that tells you that you can save your work or submit your application. You must have all green checks to submit your application. This document cover sheet must be included with your submission, and then you continue on to the payment page. And again, this gives you estimate, and then you would just continue on and get your fees and then continue to your checkout. You can pay by credit card or by check. Okay, so I'm going to go ahead and go back, and what you're going to do, you're going to submit 2 copies of your case studies and your reports, and you're going to send it to our office. Everything after you hit the submit button, you're going to only have 5 days in order to submit for us to receive that information. So let's see here. Some tips there's plenty of resources, and obviously I'm running out of time. On the website, you can get all those, but we have your checklist, complaint policy. We have marketing tools for you. These are really nice. You have some stickers for your practice. We have press releases, and that'll be your accreditation certificate and portfolio and so on. So I don't want to diminish or take away from the time we have. So again, tips for success: create a culture of quality, start now, download and review your dental standards, edit the policies as appropriate, involve your key dental staff, select good case studies and final reports, use the checklist and resources available, and please, please contact the IAC. This is what we do. This is why we're here, and we'll set up a conference call if needed to get you through the accreditation process. So I apologize for being so wordy. Again, I just do get carried away. But I want to thank you all. This concludes the actual formal presentation. We're going to now have time for the question and answers session, and Linda will be taking over for that. So if you have a question, go to your Q&A tab in the upper left and ask away.
Okay. Hi, Mary. It's Linda again. I'll take over for Leslie, and just wanted to remind you all that we are recording this presentation, and it will be posted to the website sometime in the near future, for the next few days. You all will be receiving a survey following the webinar. Generally, it's within a few hours you receive a survey via email. And Mary's showing you how to access the Q&A, clicking on that, and it looks like a number of you have figured that out, and I'm glad about that. I wanted to show you, too, while we're doing the questions, if you go to the upper right-hand corner of the screen, there is a small icon that looks like 3 pieces of paper. Click on that to download the handouts for this presentation. On your slide, on your screen, is not this presentation's handouts, but it includes the slides. And what else do you have there, Mary? It looks like you have the standards
and the checklist.
And the checklist, yes. Mm-hmm. So you can put a little check mark in the box and then download those to your computer. If you are not able to get those during the webinar, during this presentation, please send an email to webinars@intersocietal.org, and Lawrence and I will help you out with those handouts. Let me go over the first question. ULIM has a couple questions. Is CT accreditation something that will be required for all practices or offices that have a CBCT scanner in the future? Or is it similar as to some doctors that are being board certified versus some doctors that are not board certified? Similar situation to that.
Let me see if I understand the question. Accreditation, one, is a voluntary process, a review of your processes by a peer review. What CMS has done is made it mandatory in some private payers as a mechanism to be reimbursed. So anyone that applies for accreditation has to meet the training experience requirements that are listed in the standards. So I'm not sure if that answered your question. You know, I'm not real sure if that answered the question or not.
Okay. ULIM also has a question about report documentation, and there was a question earlier that came through, Mary, about the report that you did show, the sample report. Is that on the website?
It will be. It will be.
It will be posted.
Yeah, we've asked for, we have clearance or allowance, authorization to post that from the person that actually
provided that.
Provided that, yeah. So, yes, we will provide that as a template for you to use, or a sample document. Actually, it's not a template, but it's a sample document.
Okay. ULIM's other question is, with the report documentation by a qualified person, if we don't have a local radiologist that can read the scan for us, do you have any suggestions on how to get companies or facilities that read them?
That's a very good question, and you have to look at the standards. It's possible that your dentist may qualify to read their own interpretation if they want to and if they're qualified to do so. Again, you need to look at the standards. If your physician, if your dentist have been reading dental CT scans, and they may qualify under one of the training experience pathways, and they're very specific, so you need to look at those. I suggest that you call me directly or call one of my staff, and we can walk through each of those training experience pathways. If your dentist chooses, wants to have a radiologist read, there are plenty of groups out there. You might want to check with your colleagues in radiology or in the medical field to help you. We don't recommend any particular groups. Generally, they're not hard to find because there are many radiologists that do readings for dental community.
Hey, Laura's question is, does every staff member who takes a scan, I think performs a scan, need to meet the technical requirements, or just those who are on the application?
Very good question. Anyone operating the scanner needs to meet the requirements. So anyone that's operating the scanner needs to be one of their training and experience requirements.
And they need to be included on the application as well, right?
Yes. Yes.
Okay, Robin's question is, my office does not participate with Medicare or file Medicare claims. Does this accreditation apply to my office?
Well, that's a wonderful question. We have provided voluntary accreditation for imaging facilities for 20 years now. Again, voluntary. We all obviously feel accreditation is important for patient care, to demonstrate to your patients that you care about quality and you have a commitment to quality by turning in your information and having a peer review or a peer evaluation of that. That stamp of quality from the peers is really important to differentiate yourself from others in your community. So from a quality standpoint, a radiation safety standpoint, you have someone checking to make sure that you're following standards that were written by experts in the CT community. So, is it required? It may be required for some payers. It's certainly required for Medicare reimbursement. But from a pure quality standpoint, it's not required. But, again, from a patient care standpoint, it is a good thing. So the decision is yours.
So Deborah and a couple others have asked about continuing education. Deborah want to know if the CE credit is specifically available for this webinar. And then somebody else was asking if there's resources or you have some ideas of where they can get CE credit.
That is always the question about CE. I told you in the presentation, we actually are going to be working with the dental communities, and when we hear of any CE that's offered that meets the standards, we will be posting that. We hopefully in the future will be able to offer some CE through webinars such as this. This is our first dental webinar, by the way, so now I know I need to chop some of it out, but we'd always put it on our website as a resource when we hear of it. And again, we're getting used to the dental community. We're working with some organizations to give us that information. So when we do receive it, we will post it on the website. Again, check with your manufacturer particularly for the radiation safety and, of course, for the operator training that can come through them.
And this is Sandy. Also related to the continuing education, you should check with your dental specialty societies because we believe that they are going to start offering some dental education or some CT education that will meet our requirements as well. And you might even want to put a little pressure on them.
Perfect point, Sandy. Very good. Yes. We've seen this work in the ENT community, the same thing. They were lacking in some CE resources or CME resources, and they went to their societies and put pressure on them, knowing that, accreditation is required, and as a part of accreditation, CME is needed. So that's a very good point.
There's several questions that have been coming through, Sandy and Mary, concerning about the website. People are asking for samples and documentation, and there are samples on the website. And I'm sure if they were to email you or contact the staff, they can get more stuff on the website.
Yes.
So you can just kind of comment on that about the samples on the website.
Yeah, we definitely are, we're not complete yet. As we get more information from the dental community and we are putting templates out there, we'll have the report sample as well as a report template. We have a generic policy and procedure template that is coming that should be up there, in the next week or so. We do offer guidance. It's really, we're not looking for university policies and procedures. Truly think about what you do in your facility and look at the standards. You can make it very simple. And most of the time you can call us too, and we'll ask you, well, what do you do in your practice? And you'll tell us, and we'll say, well, that's your policy. But we can help you with that question, and we will be beefing up our website with some additional documents for you to reference.
William wants to know, is the $2,600 fee annual or every 3 years?
It's every 3 years. The accreditation cycle is a 3-year cycle from the date that your go to decision, and it is 3 years.
Let's see. Tressie has a question. It says, in reference to the dental technical staff training and experience requirements, do we need to require the manufacturer conducts the 4-hour documented training, or can the doctor train the employees?
The standards are very specific. You need to have documented manufacturer training. So we can, the standards are specific. So we can talk about that offline. Some situations may be that you haven't had the manufacturer in for a while. Manufacturers know that accreditation is required for Medicare reimbursement. So someone in your practice needs to have gone through that manufacturer training.
And they're usually very, very open to coming in and providing the training. That's our understanding anyway.
Yeah. If you have issues with that, please give me a call and we can talk about it.
Another brief question from Tressie is, on the report content, what did you mean, or what is required for quality of study?
Oh, okay. Bottom line is, if there's an issue with the quality of study, it's generally when you'll see a comment in the report. If you had a patient that moved, if it was not an optimal study, although you didn't want to radiate the patient again, sometimes the interpreting physician will note patient moved slightly during exam, however, still of diagnostic quality. But, it's nice to acknowledge that it's not your best work. However, it's diagnostic to a point where it wasn't necessary to repeat it. So the quality of study, some physicians actually say, excellent quality or fair quality or good quality. It's assumed that it's good quality unless there is a note there. So quality of study is something that is in the standards as listed. So it should be part of your template. And particularly if the study is not, up to par. However, for accreditation purposes, you should be submitting your best quality images and reports.
A little bit of clarification is being requested as far as the 3-year reaccreditation. It says, regarding the 3-year reaccreditation, is the same fee required every 3 years for reaccreditation versus a new accreditation? And maybe you can, elaborate on, they still need to provide the same case studies and the same fee. So,
okay. The one thing one part of the program that, again, when I do this presentation again, the fee is $2,600 for one CT unit when you apply for accreditation. During that accreditation, you will be audited or site visited at one point at some point within that 3-year cycle. When you reapply for accreditation, yes, the fee will be, at this time, it will be $2,600 because you will be reevaluated. And 3 years is a long time. Sometimes staff change, sometimes equipment changes, report content as far as accuracy or comprehension may change depending on the physician. So yes, the fee is, there will be a fee at this time at reaccredit is $2,600 if you were reapplying today.
I'm seeing a couple of things, Sandy and Mary, a couple of folks commenting on the requirements in California specifically, and they're saying, the participants are saying that they're going to give you some more feedback in the future. But this one is a very specific one about the California state regulations. Sanjay says that if the anticipated radiation dose is less than 10% of the maximum permissible dose, the staff do not need to wear personnel dosimeters. How do we deal with this for our staff who do not have personnel dosimeters?
It's a state, if you have state documentation or physicist documentation that you've gone through a process to evaluate through dose monitoring or some type of area monitoring, we would want that documentation. So you would need some type of documentation that would waive you from doing continuous monitoring. It would be documentation that you've gone through a cycle of area monitoring that the state approved or a physicist approved, and you could turn that in.
Diane is asking if the CT is being acquired for placement of a dental implant or any other dental-related procedure which is not covered by Medicare, can you still bill the patient?
Oh, we don't know all the billing requirements. We just know that if you do indeed bill a CT to Medicare, that it has to be accredited in order to be paid. The one thing that we are not familiar with are specific CPT codes and billing requirements.
Yeah, you might want to check with your payers.
Have just a couple more quick questions, and then we'll wrap it up because we went a little bit over. Patty asks, in an established oral and maxillofacial surgery practice, if the surgeon is board certified, that meets the requirement for medical director with just the 15 hours of CE over the next 3 years?
They have to meet all the requirements that are listed in the standards. Now, they have to, the training experience requirements are clear in the standards. He would have to, or she would have to indicate which training experience pathway, and not knowing all the training that your surgeon has had, you would want to look at each of those pathways. So there's a formal pathway, an informal pathway, and an established practice. Depends on how many years they've been doing CT, how many years they've been interpreting CT, and then there's some additional training experience requirements. So that's something, you know, if you have a question about it or you don't think, you're not clear about what the standard is saying, we can talk about that directly. But please look at the standards, talk to your surgeon, and find out what his or her training is and see if it does meet with the standards.
Okay, this is the last question. It's from Kathy. She was commenting that the ADA only offers a 3-credit course, and there's not many courses available through dental societies, especially to reach that 15 CE requirement. And she asked, would we have to go to a medical course? Okay.
Well, right now, the 15 hours are a requirement in the standards. Again, the board realizing this is a new accreditation program and realizing that CE may be difficult right now to obtain, you can apply without that. And as more these societies get involved, hopefully there'll be more available to you. But you can apply right now without having that and then obtain it within the 3-year cycle. So, yeah, as we get more information, as societies do give us that information, or if, you even search and you find some CE, we will definitely post that, and we'll only post the CE that actually meets our standards. So if it does not have the required designation of CE as listed in the standards, we won't post it on the website. But if it does, it will be posted on the website. So I know that's a problem, and again, that's why the board's very sensitive to that issue, that this is a new program, that there may not be upfront, you may not be able to obtain the 15 before applying, and that's why they've given you some leniency when you first apply, that you don't need to have that immediately, but you must obtain it within 3 years.
Thank you, Mary. Let's turn it back over to Leslie to finalize everything.
Thank you. If your question was not answered during the presentation, please email or contact the IAC CT team directly. Thank you for participating. This concludes today's webinar. You may now disconnect.